This video contains mature and/or graphic content. Parents are advised that these images may not be suitable for young children.
Hello, everyone. Thanks for being with us. Joining us today is OB-GYN Dr. Nita Landry. Welcome to the show, Dr. Landry.
Glad to be here.
Okay, so we're going to start this off, and I'm curious both of your opinions because it does touch upon both of your professions. A plastic surgery trend that's on the rise among teen girls. It's not what you're thinking. It's actually vaginal rejuvenation surgery. It's gone up 80% from 2014 to 2015. Now, teens?
Well,
vaginal rejuvenation as a teenager?
I suppose it makes sense, though, because if you have a problem, something that bothers you at that age, you may start thinking about making changes.
Yeah, changes, but they're not adults. They're teenagers.
Well,
teenagers.
I know, and I
Thank you, Dr. Landry.
Let's back up.
Thank you.
So when we're talking about female rejuvenation, it may be just external changes, labia majora, labia minora, reducing those, enlarging them, making them more aesthetically or cosmetically attractive. And then the second part is tightening procedures that is really more for older women after childbirth, etc.
But do you sometimes think you get so focused on the art of plastic surgery that you can't step back? I'm not saying you personally, but Dr. Landry and I are sitting here thinking, you've got a 16-year-old, a 15-year-old in there.
I'm all for beautification, but with teenagers, there are certain medical situations where it's appropriate, like if they're having irritation or pain with physical activity, if they can't keep the hygiene up with their menstrual periods because the labia are so big, then that's one thing. But for cosmetics, like your public service announcement, your labia is beautiful. They come in all shapes and sizes. They're fine.
You're right. And you're too young to really make a honest, informed consent.
Yeah, but my question is this, twofold. Number one, what is it, the mom coming in with them and saying, hey, let's make it more beautiful? And number two, are teenagers flipping through catalogs saying, oh, that one's beautiful, I want mine to look like that?
Exactly.
Really?
Yes, people Photoshop their labia, so they have unrealistic expectations of what they look like. And in some instances, parents don't understand that there are variations in the anatomy. So they're like, oh, her labia doesn't look like my labia, so there must be something wrong.
It's almost labial peer pressure, right? I want to look like everybody else. And part of it, the grooming is so different that we're shaving, we may not have any hair at all, things are more prominent. Other thing is another condition you touched on, that there may be indications where things have changed, actually causing friction. If somebody was significantly heavier, like grossly obese and then lost weight, that you may be left with loose extra skin there. But I think those are the exceptions for somebody that young. I mean, there are indications for doing breast reduction at a young age. Certain plastic surgery procedures lend themselves. Doing it on teenagers, I don't think this is really
I'm curious, is there a risk beyond, obviously it seems premature, but labia has a lot of nerve endings, and you go cutting around there or plumping or whatever it may be, does that not come with risks?
Absolutely, and you bring up a good point. You consider it to be a pretty simple procedure, but there are risks: bleeding, infection, scarring, chronic pain in the area, pain with sex. And of course, they might not like how it looks after it's done. So you always have that risk.
Yeah, but it is a pretty straightforward operation. And I would say that in terms of patient satisfaction, it is one of the highest. But I think any parent would be ill-served to go recommending to their kids that they do that before the age where they have the ability to make that decision on their own.
We're going to start a movement, and we're going to pass it on to our daughters and nieces and all that good stuff.